The Greater Flint Health Coalition and its partner organizations, including the Genesee County Medical Society, Genesis Health System, Hurley Medical Center, McLaren Flint, Health Plus of Michigan, and the Genesee Health Plan, encourage physicians to implement medical group visits in the treatment of their patients with chronic conditions. Group visits are an evidence-based best practice that support physicians in providing patient-centered care focused on disease self-management in a way that benefits both patients and providers. The group visit model is simple in concept and easy to implement. Nationally recognized health institutions are utilizing group visits with great success, as demonstrated by the Cleveland Clinic.
A shared medical appointment is an appointment where multiple patients are seen at the same time.
You meet with other people that has the same condition that you have.
You got a little more of a conversation with a doctor than 10, 15 minutes you're in his office.
The assistants will take blood pressure, height, weight. Then we'll start the session. While I'm finishing the chart, after discussing one patient, she will be discussing the different topics.
I do the cleansing breath.
It's very laid back. It's a relaxed atmosphere.
Once the patients are checked in, we want them to feel safe, secure, and we really want to remind them that this is shared medical information that should stay within this room.
I think that it's very beneficial as far as sharing your information because you are helping other people.
It is a role of education, but I think it's also a role of bringing everybody together as a group.
The more that you listen to him talk, the more you do get out of it, even more so than you would on a one-on-one.
They learn also from the other patients.
My blood sugars was high today, so was somebody else's. And if they've done something, then they can share it with you. So, okay, I'll try that.
And sometimes I'm just facilitating the conversation and they're having the conversation. If they leave with one thing that's going to help them, we've all accomplished what we set out to do.
Find out you're not the only one that has these kind of problems.
When you come here with a whole group setting, it encourages you more to, stay focused and, do what you have to do or what you need to do.
It's almost like a family type relationship.
I do feel the patients get a better visit because I think they have an opportunity to take more from it than what I might do in the traditional one-on-one.
Since the first day that I came, the first time that I came, I loved it because I didn't feel like I was out there by myself. I felt like I had hope.
In general, as a group, they tend to do better.
You can role model really good behavior. Patients actually see success.
You lost about 20 pounds in weight.
It helps you deal with it better.
I actually got quite a bit of helpful little tidbits today. It's kind of got me geared up to get out there and get going and try to make some changes.
It's called a shared medical appointment because the sharing is the strength of it. When you think about something that makes you feel better as a provider, the patients feel better and empowered. It's a recipe for success that you really should try.
Local Genesee County physicians implementing group visits to treat diabetes have observed the benefits of group visits firsthand for themselves and their patients. These physicians find group visits beneficial or very beneficial to patient education, adherence to disease management, clinical outcomes, access to care, and satisfaction, as well as the overall quality of care, achievement of goals, and productivity within their practices. Group visits provide diabetic patients more time with their physicians, something they desire, and offer greater opportunities for patient education. Almost across the board, group visit patients being treated for diabetes demonstrated greater confidence in their knowledge or practice of diabetes management. Over time, diabetic patients attending group visits have decreases and reduced fluctuations in their hemoglobin A1C. A decrease in low-density lipoprotein measurements was also observed. Group visits are reimbursed at the same rate as a traditional office visit as long as physicians spend one-on-one time with each patient to conduct a brief chairside exam. The same documentation and coding rules apply, with a typical group visit being billed as a CPT code 99213 or 99214. The Greater Flint Health Coalition's Group Visit Project has resources available to assist physicians in implementing group visits, including a medical group visit implementation guide, HIPAA-compliant web-based diabetes registry, and physician champions willing to share their experiences and expertise. For resources or additional information on implementing group visits, please contact the Greater Flint Health Coalition or visit our website at www.gfhc.org.